Hello, and welcome to How Do You Keep Well podcast. Thank you once again for joining me this morning, this Saturday, beautiful morning here in the UK and wherever you're joining from. And on How Do You Keep Well podcast, this season is just dedicated to women's health. And I'm always so excited to bring specialists from every walk of life to come to talk to us in very simple terms, how we can manage our health. And definitely on this podcast, we unlock the secrets to feeling amazing in your body, in your soul, and in your mind. So, my name is Dr. Jaye. I'm your host, I'm your cheerleader, and your guide as we navigate this fascinating world of women's health and well being in this podcast season. Well, if you're ready to laugh, if you're ready to learn, and if you're ready to take charge of your health, you're welcome. You're in the right place. And to be honest, my mission is simple it is to empower you. Yes, you, that incredible lady. Yes, you listening to us this morning to live your fullest, healthiest life. And I believe that when women thrive, entire communities thrive. And my vision is just really to create a ripple effect of well being where every episode of this podcast leaves you feeling like, yeah, I can do that. And it leaves you feeling kind of, good. So today we're talking about an often overlooked but incredibly important topic. And I don't know how our conversation will go today, to be honest with you, but we are focusing on the menstrual and pelvic health during perimenopause and menopause. And the question is your period too heavy? Okay. And joining me this beautiful morning is a beautiful consultant. She is the brilliant Mrs. Moka. She's a consultant obstetrician and a gynecologist at the United Lincolnshire Hospital Trust. She has been helping women for as long as I know, navigating various gynecology and obstetric challenges over the years. Mrs. Moka, thank you very much for being here today.
Thank you for having me. It's my pleasure to be here.
So, just before we dive in, I would like you to share a bit about what drew you to focus on women's health, especially reproductive, post-reproductive health. And when I say that, I mean midlife and beyond.
Um, I got introduced to obstetrics and gynecology in my own home growing up, actually, because my mom is a gynecologist and obstetrician. So I suppose that one could say that would be the natural, introduction to the specialty. Um, but when I then went to university, I went to medical school, I found other specialties interesting. So then I started to consider ophthalmology, radiology, urology, surgery.
All the surgical
um,
specialties.
yes, essentially, I was going to be some sort of surgeon. I wasn't a medic by,
By nature.
interest. I knew that I wasn't going to be a physician or a pediatrician. So, but as I kind of started to think about postgraduate training, there were some um, contributory factors, I suppose, to being an international medical graduate in the UK at the time that we came over.
Mm,
So I suppose that there were some extenuating circumstances
mm,
that then led me to go back to my original first love, I suppose, in obstetrics and gynecology. And one thing that I'd always kind of had as, I suppose, the baseline is I feel that if I was to see an obstetrician and gynecologist, I would like to see a female one. This is
mm,
just my own preference. And
mm.
so I believe there are other women like me. And yeah, that's another, main thing. Over my career, I have come across brilliant male obstetricians and gynecologists. So this is not to say that there aren't any, but for some people, if they could, they would prefer a female. this is not discrimination. And obviously, if there is an emergency, I feel most people would want the best person trained to do the job, whether they're male
Absolutely.
or female. So,
Absolutely.
again, this is not to say, it's okay to say, I don't want a male doctor, end of. It's all,
Mm,
within
mm.
reason. So,
But
yes.
it gives women the choice, when you have the choice, it's better
Yes, if
than
you
when
have the
there's no
choice.
choice at all.
Yeah,
And
yeah.
sometimes when we see women, you say, "Oh yeah, when you've had children, there's nothing to hide anymore." But you still find some women who still want to see somebody of their own gender. But one thing that I like is what you said there is like mother, like daughter. And I always find that the role of a mom in a daughter's life, goes so far and so
Mm,
wide. And I personally can definitely say that yes, my mom's role, even though my mom is an accountant, I completely went the opposite way. But at the same time, I think she has imbibed some values into me
yeah,
that
yeah.
wherever I go is always going to stand me out. So thank you for sharing that personal information there. So we're going to go straight into the topic for today, and one of the ones I really want to us to get into is the menstrual changes that actually happen in midlife. I often see a lot of women who come in complaining of fatigue. I'm tired. I can't do anything. I have had my own personal experiences with fatigue. I've seen some of my own family members who've had fatigue. And most of the time, by the time you drill into it as a GP, one of the reasons is because women have heavy menstrual bleeding. Now, in midlife transitions, especially in perimenopause, we know the bleeding pattern can be unpredictable, very unpredictable. Tell us, Dr. Maureen, oh, sorry if I call you Dr. Maureen, I hope you don't mind, but what are some of the most common menstrual changes that some women experience, especially maybe after they've had babies or when they're in their midlife in 40s or thereabouts? Like, talk us through it.
So I think that the first thing to note is that everyone is different.
Mm,
So there are, general things that you can expect, but as with probably most things in life, there will be a curve. So some people will be at one extreme of the curve, some others will be at the other extreme of the curve. They will be fewer in number than the main bulk that are in the middle of this curve.
yeah.
So it is not uncommon that there can be menstrual irregularities as one approaches the menopause. Research is telling us now that the signs and symptoms of the menopause can start about 5 to 10 years before menopause. So menopause is when the periods stop.
Yes.
Because the periods can stop and start for some time before the final one, menopause is a diagnosis made in retrospect. So it's only after at least 12 months of no periods in someone who is at least over the age of 45 that you can then more confidently say they've gone through the menopause.
Mm,
Obviously, this is when you haven't done anything to stop the periods. Obviously, if you've had a hysterectomy, well, you won't have periods. If you have a
yeah.
hysterectomy at 30, you haven't become menopausal necessarily.
Mm, no.
So this is where there has been no, action taken to stop the periods. If the periods have stopped for 12 months or more, then you can say, oh, the person went through the menopause
Menopause.
at that
Mm,
time. Now,
mm,
before 40, it would be termed premature menopause or it will be termed um, premature ovarian insufficiency.
mm, mm.
Before 45, it would be called premature menopause. But
Right.
after 45, then it's menopause. The general average age of menopause in the UK is quoted to be about 51, 52. But again, that is an average. There are
Mm,
people who are having periods up till 55, 56. They will
mm,
be in the minority, but
mm,
it is not, completely unheard of. So many people will have lighter, less frequent periods, but also some will have heavier, irregular, sometimes more frequent,
mm,
prolonged,
mm,
can be quite heavy.
mm,
Um, there is no fixed. If it's heavy, then it's menopause. If it's light, then it isn't. There isn't any sort of fixed thing like that.
mm, mm,
To put into the mix, some people will be on some kind of hormonal treatment, and sometimes they can muddy the waters, as it were. So you might find that actually starting a kind of pill worsens the bleeding, or having a kind of hormonal treatment, say the depot injection or the implant, can
mm,
make the bleeding pattern worse.
mhm,
Unfortunately, you have to have tried the method to realize that this is how you are going to respond to it. So
mm.
it's difficult to know how each person is going to respond to whatever
It.
type of treatment that they are having.
Mhm,
Also, the body is changing. So some people will say, oh, I've been having the implant for 2 years, then I had a baby, and then I came back and I had the implant, and now it's like this is a very different reaction. The body is changing. There are so many things that contribute to the menstrual cycle: our weight, our diet, stress, exercise. They're so, like, the body is so fascinating. You can't put everything in strict black and white boxes.
mm, mm, mm.
So there are obviously hormonal changes going on, there are physical changes going on, there are
Yes.
psychological changes going on, there's life going on.
Happening as well.
Life is not stopping because one is going through the perimenopause. So there are so many factors going on. And I think sometimes knowing that one is not alone, sometimes knowing that this is not uncommon, this is not, you know, abnormal, may be reassuring. This is not to say one shouldn't seek treatment or an improvement,
Yeah.
So there are so many contributory factors. There isn't
Mm.
just one magic pill to solve everyone's problem.
That and just to come in there, and that is something I always focus on. There is no one size fits all. You need to know yourself maybe before you have children, which we all do, and then the changes that happen after you have children. That's if you have children, and then you would then notice at a certain time, like you mentioned, the average age of menopause for most women is 51 to 52. But 10 years before, for most women, they will begin to notice that change, and that kind of fits in for most women around the age of 40, 41. And often as a GP, I would get a few women coming to tell me that my period never used to be like this.
Yeah.
And I say, well, welcome to the world. Your body is changing, like you rightly said. But can I just ask, because it can be quite confusing, what I call heavy menstrual bleeding is going to be different from what somebody calls heavy menstrual bleeding. How do we actually define this? Because I find some women actually assume it's normal. So when they come in to talk to me about fatigue and they tell me about how they're bleeding, I'm like, that is like serious bleeding. That's why you're fatigued. But they don't see it as heavy menstrual bleeding. Is there any way we can maybe make it easier for people to understand what heavy menstrual bleeding is?
So there isn't a fixed definition in terms of how much volume of blood is heavy, because again, we're all different. So a 60-kilogram woman and a 100-kilogram woman will generally have varied levels of blood volume,
Mm,
because the physiological, assessment of how much anyone's blood volume is based on their weight. You would say per kilogram body weight, you would expect such and such mils of blood. So that would probably then say that if somebody whose total blood volume is 5 liters, let's say, loses a liter of blood, it would be 1/5 of their total blood volume. But
mm,
if somebody's blood volume is 4 liters and they lose a liter, they've lost a quarter.
they have.
So already, by nature of the build, what is considered heavy for one person may not be heavy for another in terms of the effects that it's going to have on them physiologically.
Mm,
So that's
mm,
one thing. Another thing is, if someone, for instance, oh, I just don't like the sight of blood. I just don't like the sight of blood. If they have a cut and they are bleeding, they're going to think this is too much. This is too much.
Mm.
But for somebody for who blood is actually not an issue, they
Mm-hmm.
may actually be bleeding heavily and it's not an issue because they're not, phased by it. So it's always going to be subjective. But there are
Right.
objective ways of measuring
Mm-hmm.
whether somebody's bleeding is heavy or not. If someone says, my periods are fine, but you check their hemoglobin and it's 70, and there is
Mm.
no other explanation for the blood loss, but they are not fine. They are heavy for you,
Yes.
for whatever
Mm.
reason.
Yes.
Also, diet plays a part. So obviously, if the diet is not right anyway,
Mm.
then they're not going to be getting the nutrients that the body needs to build their blood. So they're more likely to be anemic, both diet contributing,
Yes.
periods contributing. So somebody
Mm.
who may have quite a poor diet, even if they had what may be considered a normal blood loss, because their diet is not able to replenish, over time, they will end up being anemic.
Yes.
So there are so many factors. Generally, now the definition is whatever is heavy enough to affect daily activities of living or the quality of life of a woman is heavy. There
Yeah.
was some definition about 80 meals, but who is standing
Who is
over a
counting? Who is counting?
container
Who is
for the three,
squeezing
four,
and
five, six,
counting?
7 days, 24 hours of those days to measure every volume of blood that comes out? So it's difficult. If you use a menstrual cup, it's probably easier to measure. But how many people are using a menstrual cup?
Mm.
So
Mm.
we've moved away from a fixed volume
Mm.
as such. It's more about having
Impact.
objective assessments of the impact on the quality of life. Obviously, if somebody says, I am changing my pad every hour, it's quite a big pad, it is full every hour, that most people will agree is heavy. But you
Mm.
hear people who say, oh, I change my pad every 2 hours. And you say, oh, was it full? Oh, not really, but I just thought I would change it because I want to be clean. Well, you kind of need to explore why they're changing it every 2 hours
Mm.
rather than to assume that just because they've changed it, it must have been full and overflowing. Because
Yes.
again, we're all different in what we think. Oh no, I just want to change it because I don't want it to have a smell. I don't want. So if somebody is anemic, it's certainly heavy. But
Mm.
if they are not anemic, does not mean it's not heavy either. Because
Mm.
if they normally run at a hemoglobin of say 130,
Mm.
and after their period, their hemoglobin is 110. 110 is probably still acceptable as
Mm.
normal.
Mm.
But you can notice that that has been a significant drop in their hemoglobin. So they may have heavy periods.
Yeah.
So I think there has to be more thorough history taking to try to ascertain, is this
Mm.
heavy or not? If this person comes and says, my periods are very heavy, and you say, how many days do you bleed for? And they say 2 days, then you think, okay, they probably are heavy, but the last 2 days. So you are
Body is compensating.
probably
Mm.
not, hemorrhaging overall as
Mm.
much as someone who has 5 or 7 days with
Mm.
3 or 5 of those days quite heavy.
Mm.
If someone says, my clothes, my beddings, the chair, the sofa were all soaked with blood, well, I feel like we would all agree that that is quite heavy.
That's heavy. And I
So,
often get that, Dr. Maureen, I get women who tell me that they can't go to work, or they work from home because they can't, they're changing their pad. And like you said, there is that general acceptance that, oh yes, from what you described, that sounds quite heavy.
heavy.
So we really need to be, but what I worry about is some women who perhaps don't even know when to, and because you
Seek
talked
help.
about, and yes, when to come to see the doctor, are there any signs or changes that some women might notice that would make them a bit more bold and confident to come to speak to the doctors, apart from fatigue, for example, which you talked about?
So I think that we are beginning to get the message out there that well, everyone, men, women, need to take responsibility for our own health,
Mm.
because we're not going to go into every woman's home and ask every woman or every, one having periods, how many times you change your pad? Was it very full? Was it not? So at some point, there has to be some personal responsibility
Mm.
for our health, right? Um, there are signs you can say, are you tired? But, there are people who are not having any periods who are tired. 1 plus 1 is not necessarily 2. So I think it's just about educating people to say, if you think that your periods may be heavy or maybe heavier than normal, then seek a review with your GP, because you may be right. And you may not be right. It may be that
Mm,
actually this is fine for you. It may be some questions need to be asked, some tests need to be done. But I think it's going to be difficult to be able to tell people the exact things that make up a heavy period. I think it's
mm,
difficult. Obviously, if the person is fainting because of the amount of blood that they have lost, then obviously that is significant.
mm,
But it's difficult to, because if someone has got 5 children, they're all quite young, you are doing a lot, you are likely to attribute your fatigue to how much you're
what you're
physically
doing.
doing, which
Mm,
that would be contributing. It's not
mm,
just the menstrual loss that is the cause. There are
mm.
so many
Other
factors
factors.
contributing, and many people live busy lives. So it's not
Mm,
wrong to think, actually, my busy life is a big contributor to why I am tired.
feeling this way. Mm. And moving on to kind of the treatment available. I was actually reading, and I wasn't even aware of the treatments available. I didn't know people could actually buy things like tranexamic acid over the counter. It's called Ivana. But I just
All
wanted to.
right.
I didn't know that as well. That apparently it came in.
No.
Yeah, but I will research that a bit more to find out. But yes, people can buy it over the counter. But can you talk us through maybe some of the general treatments that people can expect their doctor to talk to them about when it comes to managing heavy menstrual bleeding?
Yeah. So I would usually say that the treatment options are divided into hormonal and non-hormonal. So you may find, young ladies, as they start their periods, menarche, that the periods are probably more likely to be infrequent, not heavy. But as the periods continue, they may become heavier. So you might actually find mid or late teens being the patients presenting with heavy periods. In those instances, especially if they are not sexually active, they do not necessarily need hormones for contraception, which you
Mm,
could then say, well, the contraception would be serving two purposes: contraception and non contraceptive benefits of managing periods. Some people do not want hormones if they can help it, which is fine. So the non-hormonal treatments for heavy periods would be in the form of tranexamic acid.
mm,
So tranexamic acid is given to be taken with every period. It's
mm,
not something that you take once and that's it. You have to then take it with every period for about 3 to 5 days, and it's to help reduce the heaviness of the bleeding. Some people have said they found that the heaviness is reduced, but their periods tend to last a little bit longer. I don't know that that is everybody's experience,
mm,
but that is one non hormonal method. There is another non hormonal method called endometrial ablation. That
mm.
would generally be for people who are further along in their lives, because it's a treatment, heat treatment, to the lining of the womb, which it is recommended that the person does not get pregnant after that treatment, because the heat treatment to the lining of the womb means that it would not be safe to then have a pregnancy trying to grow or implant in that endometrium lining of the womb.
Mm. It's not healthy
So
enough. Mm,
that is a treatment that is possible, but not sort of in the reproductive age group, or someone who is wanting to have children or maybe wanting to have children in future.
mm.
The other thing to say is that if somebody has had 2 or more cesarean sections, the cesarean section scar has to be a certain thickness for the endometrial ablation to be recommended to be done. Because if the scar is too thin, because
Oh.
this is a heat treatment, you don't then want the heat to be transmitted through that very
Right.
thin scar to other organs
I didn't
in the
know that.
pelvis. So there are a few, yeah, there are some considerations. I mean, I suppose this is what the gynecologist would be
Would be doing anyway.
investigating and
Mm,
confirming
mm,
before they do the endometrial ablation. But it's just sometimes if the GP is getting into this conversation with this woman, those are the things. If the woman says, "Oh, I've heard about this, can I?" Then if you already know the woman has had 3 cesarean sections, you can say it may be that you wouldn't be suitable because the scar may
mm,
be too thin to be able to have that treatment.
mm, mm.
Also, to have that treatment, there has to be investigations done prior. Make sure the endometrial cavity is normal.
Oh, I think I've lost Dr. Morin there. I'm hoping she can come back on very soon. She was at the point of discussing the different treatments that is available for people who have heavy menstrual period. I'm hoping she can join back soon. Let me have a quick check. But one of the topics she's just talked about was the non-surgical treatments available, or the non-hormonal treatment and the surgical treatments available. And we were talking about the endometrial ablations. So hopefully she can join us again soon. Let's see how that goes. Uh, ho- if not, we will pause and then we would join back again. Let me check and see whether she is coming back on. Okay. I find it really interesting that the endometrial ablation has certain people who can't use it. So one of the things I always say to women is, look, there are other options available. So something like the Mirena coil is also an option. Obviously, this is an hormonal option, and I'm sure Dr. Morin would give us a bit more lowdown on that in a few minutes. Let me have a look to check where she is. One moment. So we may have to pause for a moment whilst I find where Dr. Morin is. So hold on, we'll be back shortly. So whilst we wait, I'll just quickly talk about also the lifestyle modifications for women who have heavy menstrual period. Definitely looking at your nutrition is actually quite important. So one of the things we talked about is the fact that a lot of people, when they lose blood, their body needs a lot of iron to help them make more red blood cells available. So one of the things you really need to be looking at is your diet. If your diet is quite low in iron rich food, then you really need to be making up for that as much as possible. The other thing to look at is stress. We've talked about how stress symptoms can actually mimic the appearance of fatigue, which also could be due to other reasons. So there is that need to manage stress in your life as much as possible as well. So I'm just going to go off. So because the next segment is really where we talk about endometriosis and adenomyosis and chronic pelvic pain. So please hang in there whilst I go and find Dr. Mocha. There we are.
I'm so sorry. I'm not sure what happened. I could hear you, but I think you couldn't hear me.
I couldn't hear you. I couldn't see you at all. That is
Oh,
so
I'm so
strange.
sorry. I'm
Never
so
mind.
sorry.
I'm glad you're back. I'm not too sure what happened there, but
No,
where we stopped was very interesting because you were talking about the endometrial
the endometrial
ablation, and some women can't have
ablation.
it. That's correct.
Yes, yeah,
So can we carry on from there at all?
yeah. So I was saying, well, some women are not suitable to have that treatment. I try to say, yeah, yeah, yeah. Can you hear me?
I think there is just a bit of a delay with it, but I can hear you now.
Can you hear me?
Yes, I can hear
Can you
you.
hear me?
Yes, I can. Can you hear me? Can you hear me? Okay, I wonder if we kind of break and come back in, maybe. Can you hear me? Okay, I'll
So,
stop.
yeah,
Can you hear me?
yeah.
Eh, Hello? No, I can't hear you. I wonder if we could log out and log back in. Yeah.